Happy Friday. Yes, I'm wearing the same outfit as yesterday because I recorded these videos on the same day. I really do change my clothes. Just wanted to throw that out there. Today I want to talk to you about thyroid testing, and here's why. Hypothyroidism is one of the most diagnosed conditions in this country, and women are more likely to be diagnosed with it than men. But one issue that I found out a long time ago because of doing testing personally is that most doctors only do a partial thyroid panel when they're checking your thyroid function. So a typical average thyroid panel, like your primary care physician or even what some endocrinologists will do, they'll test your TSH level, and that stands for thyroid stimulating hormone, and they'll check for your T4, which is one of the thyroid hormone precursor hormones, okay? And then if your TSH is too high, for example, that would indicate hypothyroidism, and they're going to prescribe either Synthroid or the generic levothyroxine to treat that condition. Synthroid and levothyroxine are both synthetic T4 hormones. So that's why they only test typically for TSH and T4. In functional medicine, we believe in more complete thyroid panels. So in my opinion, what a complete thyroid panel would include is, yes, your TSH, your thyroid stimulating hormone, also testing free T4, but also free T3, something called reverse T3, and also 2 or possibly 3 thyroid antibodies. Why would you consider doing this full thyroid panel? Well, let me just tell you a little bit about how the thyroid hormones work, and hopefully you'll understand it better. TSH is actually created in the pituitary gland. It travels to your thyroid, and if your thyroid is operating optimally, at a normal level, your thyroid gland will open the door to that TSH to enter. That's why, as a screening tool for thyroid function, looking at TSH is not a bad idea, because if it's too high, it means your thyroid gland was too sluggish in opening up the door, for example. If it's actually too low, that may mean that your thyroid gland is hyper and opening up the door too fast. And that would be hyperthyroidism as opposed to a sluggish thyroid, which is hypothyroidism, which is way more common. Once that TSH enters your thyroid, it converts to free T4. But it doesn't stop there, folks. T4 then travels to, guess where? Your gut, primarily your liver, to be converted to free T3. Free T3 is actually what we refer to as the metabolically active thyroid hormone, and this is what that means. T3 is the hormone that will vie for receptor sites on the cells in your body to help regulate your metabolism and your energy levels. A lot of people who have especially the autoimmune form of hypothyroidism, which is Hashimoto's disease, which is why we also want to test for those antibodies, that's what 2 of those antibodies are for, often have an issue with converting enough T4 to T3. So quite frankly, if the only thing that your doctor is checking is TSH and T4, that is an incomplete picture. It's not that you shouldn't check for those things, but without checking T3, you don't really know if you're producing enough T3 through that conversion in your gut and what's actually reaching the receptor sites of your cells. The reverse T3 is what we often refer to as an imposter T3 hormone. Reverse T3 will also try and vie for those receptor sites on your cells. Now, there's an expected range of reverse T3. Everybody's going to produce a little bit, but for example, if you have elevated cortisol, which we would know with HPA axis testing, elevated cortisol will cause an increase in reverse T3, and if that happens, again, that production of T4 to T3 is often slowed down, so you might find more reverse T3 reaching those receptor sites instead of the real T3. I know that was a lot of explanation, but just trying to help everyone understand why it's important to have a full thyroid panel. Two of the antibodies tests that are the most common, especially if you're suspecting hypothyroidism, is TPO or TGAB. These are both antibodies that can indicate the presence of Hashimoto's, the autoimmune form of hypothyroidism. And folks, in this country, 90% of hypothyroidism is caused by Hashimoto's, because the other 10% is when you have an iodine deficiency. And that's not quite as common in this country because we all grew up eating iodized salt. In other like third world countries where there's more malnutrition, the iodine deficient form might be more common, but it is estimated that 90% of hypothyroidism in this country is caused by the autoimmune form Hashimoto's. Now again, in more traditional medicine, the only treatment for hypothyroidism is that Thyroid or levothyroxine. In integrative or functional medicine, we understand that you also need to address the autoimmune condition itself and not just the hypothyroidism. In some people, if the hypothyroidism is very low level and you are positive for the Hashimoto's, in some cases, appropriately treating the Hashimoto's can cause your thyroid gland to return to normal function. You may not even need thyroid medication for the rest of your life. In some cases, like mine, if the attack on the thyroid gland lasted too long or was too severe, you still may need thyroid replacement therapy medication for the rest of your life. But there's more than one kind of thyroid medication. I've talked about Thyroid and levothyroxine. There are also what are referred to as desiccated thyroid medications. Armour has probably been around the longest. Quite frankly, it's my least favorite for other reasons. But there's also Nature Thyroid, WP Thyroid, NP Thyroid, and you can also have compounded thyroid medication, which is what I choose to do to reduce the amount of fillers that I'm exposed to. And you can tweak very exactly the amount of T4 your body needs versus the amount of T3. With the other desiccated thyroid medications, it's a set amount. You can't really tweak that so much as far as the ratios between T4 and T3. But that's a whole nother discussion if you wind up actually getting diagnosed with that. But I just wanted to mention, quite frankly, your best bet with getting a full thyroid panel is getting your doctor to cooperate and getting it done at your doctor's office, because then it can be billed through your insurance. If you haven't met your deductible, or if your doctor refuses to do that, or if you don't have medical insurance, I am able to offer that testing. I work with a lab out of Indiana called DHAA Labs. I can get an order for you. There are several labs that you can go to and have the blood drawn, and then they send the vials to DHEA, and then I get the results. A full complete thyroid panel, which would include the TSH, the T4, the T3, the reverse T3, and the two primary Hashimoto's antibodies, which are, again, the TPO and TGAB. It's $190. I guarantee you that's less than what it would be through a traditional medical practice if you don't have insurance coverage for that. But if you have insurance coverage for that, if you've met your deductible, talk to your doctor about doing that if you're interested in getting that full thyroid lab, okay? Any questions about this, feel free to drop it on the comments below. And yes, I kept this a little bit less lengthy in this video. So I'll talk to you again tomorrow and wrap up this discussion on my favorite functional medicine tests.